Success is not final, failure is not fatal, and it is the courage to continue that counts. Hello, everyone. I, on behalf of the Academically team, welcome you all to the Australian Dental Council orientation session. I am Dr. Sonal, your program manager for this course in Academically, and also your host for this orientation session. So, everyone, this orientation session is designed to provide you with the essential information about the structure, contents, and objectives of the ADC course. During this orientation session, we will be giving you the overview of the course structure, curriculum, resources, and also a lot of support. And in the end, we'll be having a questionnaire session. So, without any delay, let's begin the event of the evening, our orientation session. So I'll be starting this presentation with our vision and our academically thing. So academically is a one-stop solution for global healthcare professionals seeking abroad migration and career advancement opportunities. Based in Sydney, Australia, the team academically engages with global healthcare educators, healthcare industry experts, universities, and higher education institutions to provide demanding healthcare courses for global audiences. Next, talking about our founder, Dr. Akram Ahmed. He is a clinical pharmacist and lecturer with over 10 years of teaching and research experience in various subjects of medicine. His goal is to help the qualified healthcare professionals across the globe, the pharmacists, medical doctors, dentists, nurses, lab technicians, and physiotherapists achieve their passions and dreams by educating and training them. Thank you so much, sir, for joining us today. Moving forward, we will be talking about the vision of our organization. Academically is a one step solution for healthcare education and training that meets the end need of healthcare professionals as well as students. Academically will always be there for you to water your dreams, guide your ambitious minds, and walk you through unexplored career opportunities in countries like Australia and more so that you can prepare for your journey to success. Introducing you to our ADC instructors, we have Dr. Ankita here. Dr. Ankita, over to you.
Thank you, Dr. Sonal, for a very energetic opening of this orientation session. I am Ankita. I was joined BDS in 2007 and joined MDS in 2013. And just after my MDS, I joined an educational institute. First 1.5 years I spent in India, and then after that I'm here in Malaysia. In Malaysia, I have taught this is my 10th year running, and I love this beautiful country. Also, I have cleared Part 1 ADC exam, for which we would be starting your coaching. And the journey of ADC is all about perseverance, hard work, studying dentistry for what Australia needs to assess you on. That's about me, and over to Dr. Chandni for her introduction.
Thank you, Drs. Ankita and Sonal. I'm Dr. Chandni. I have completed my BDS in 2017 and my MDS in 2023. Currently juggling between India and Dubai. I'm practicing in India and I'm about to practice in Dubai also. So I'll be mentoring you through your ADC paper 1. And all the best to all of you. Start your journey with much hopes, and I also have a good feeling that you'll all end it up with happiness and success in this exam. All the very best to everybody.
Thank you so much, Dr. Chandni. Also on board, we have our new ADC instructor, Dr. Priyanka Rawat. Today, she could not be here with us today, unfortunately, but very soon you guys will, meet her. So let me give you a short introduction of Dr. Priyanka. Dr. Priyanka Rawat is an experienced orthodontist who completed her MDS from AIMS, New Delhi. She held the AIMS All India Rank 5 in the November 2018 AIMS exam. Currently, she is practicing as a consultant orthodontist at MS Ramaiah Memorial Hospital, Bangalore, and recently she has joined hands with Academically to provide you support and guidance throughout your ADC journey. Moving ahead, we'll talk about a creative day by day plan for success. So, all the dentists and all the doctors sitting here, it's not only always about, planning and success. It's always about the day to day effort which you put in for your exam. So, that's what we're going to talk about right now. So, welcome to a journey that will take you to your dream destination. This presentation is designed to help you achieve success in the ATC exam. We will take you through a creative day by day plan that will help you reach your goals. So let's get started. Embarking on the ADC journey. So, this is a creative day by day plan for success. Introduction, ADC exams, goals, study plan, and very, very important, practicing. Understanding the ADC exam. So, everyone, the Australian Dental Council ADC conducts written and practical examinations for overseas trained dentists who wish to practice in Australia. The application period for the 2025 written and practical examination is yet to be announced. The specific dates for the application and examination will be set only after a certain period. Now, in order to explain you the dentist assessment, I would please invite Dr. Ankita to please carry forward the presentation. Over to you, Dr. Ankita.
Thank you, Dr. Sonal. So the assessment, what does assessment mean? You have already cleared the dental exams in your own home countries, and you are registered dentist in the home country. However, Australia want to test your skills, if they would be applicable, your knowledge and skills both, for becoming a registered dentist in Australia. And the registration body in Australia is DBA, Dental Board of Australia. And the exam is designed, okay, they have outsourced it to a autonomous body, which is ADC, Australian Dental Council, which conducts exam to complete your registration process with DBA. That is the whole spectrum of the thing you would walk into. The first thing you would need to do is initial assessment. Initial assessment means they will test for your degree, your experience certificates, and your curriculum which you have done, the degree which you have done in the home country should be matching the good degree requirements as per the DBA. So that is the first step of initial assessment. That just needs you to send your documents there, and you would be created a profile with ADC, and that's how this step is done. The second step, after you have a valid initial assessment, you can apply for written examination. And after passing the written examination, 30 to 40% of the job is done. And then you would have a practical examination, which we say ADC Part 2. This, after clearing the practical examination, you can apply for registration in Australia. So what is about initial assessment? The eligibility they are looking for is minimum 4 years of full-time degree. As per dentistry, it is usually the degree. And in their words, it can also be diploma, and have held full and unrestricted registration or license. Now, for BDS graduates, for the dentists, it's the degree. For other courses, like which are related to dental therapists or something, it could be diploma also. Time frame for assessment would be 8 weeks approximately. And after you get the initial assessment done, that is valid for 7 years. That means you need to complete your written examination and practical examination within this period of good 7 years. After this, when you get the validity, you can apply for the exam anytime. And the assessment time frame is approximately 8 weeks. Then first stage is the written examination. In written examination, you should have a valid initial assessment. That's only thing they are testing you. You can apply for the written exam, and then you have the time frame of 5 months from the application period to the date of the written exam. So once you fill in the money with apply for the written exam, you would have good 5 months, and your date for written examination would be after a period of 5 months. And after you clear your written exam, you have a validity of written exams for 3 years. And in these 3 years, you need to complete your practical examination, ADC Part 2. And yes, exam dates for ADC March exams are yet to be declared. Usually they would be declared around November, before they go for the Christmas break. They would declare exams of the March, or after the September exams results comes, these dates for 25 will be declared. Then we have the practical examination. For practical examination, eligibility is successful written valid examination. That is valid for 3 years after you clear it. Time frame, again, 4 to 7 months from application period to the results. Your practical exam date will come, and then you go through the practical exam and clear it. And then the validity, that's a hooray moment, which is you clearing the dental registration eligibility requirement of Australia. Validity for this does not expire. Once registered in Australia, you are registered there. Okay. What are the examination format for Part 1 written examination? Examination structure, it is held over 2 days. Okay. The periods are March and September. For one particular exam, it is held over 2 days, and it is in 2 sections. So in one section, the morning half, you would have one exam of 70 questions spanning over 2 hours. There will be a rest break, followed by another 2 hours of exam for section 2, which again has 70 questions. And likewise, the second day. Now, this exam, written exam, can be taken from your home country. They have various centers all over the world for this exam. Okay. Now we have Australian exams, though they are testing the same subjects which you have all studied, like orthodontics, oral surgery, oral medicine, radiology, whatever you have studied. But they are dividing the whole syllabus as per 4 clusters. Now, what are these clusters? Clusters are testing some domains. Okay. So an oral surgeon need not just be an oral surgeon. He has to be a thorough professional of a dentistry. He has to do health promotion alongside. So these are some of the domains which they are testing, and they have made clusters over it. So cluster 1 is testing professionalism, health promotion. So it is information gathering cluster. Okay. Then comes cluster 2, which is diagnosis and management. They are catering to domain 6 of assessment, which is patient care, clinical information gathering again. Then comes cluster 3, which is diagnosis and management planning. And likewise is the cluster 4, patient care, clinical treatment, and evaluation. So these are the whole, some clusters which they are testing. Whole syllabus is divided classified under these clusters, and one need to pass all the clusters to pass the exam per se. Then we have, as per the syllabus, how is the distribution of the syllabus percentage wise? So this is again the 70 questions which are coming in 4 times. Okay. So 280 questions would be divided as per this percentages, like dental emergencies will contribute to 7% of the questions, endodontics would be 8%, general medicine including medical emergencies 9%. So this is how all the percentages would look like. I would request Dr. Sonal to just run through these so that participants can read it for yourself, like 8% for oral surgery. You can have an idea. But this is not very strict and tight. They can have, sometimes removable prosthodontics 4% and restorative dentistry 14%. So this is not very rigid, the percentage wise. This is just the idea for you to prepare how much is the weightage of what subject. After talking about the disciplines of assessment, I would hand over to Dr. Chandni to talk about the next phase of on the day of the exams.
Thank you, Dr. Ankita. So, on the day of exam, you need to present two different forms of IDs for you to get through the exam. So, the first one will be a primary ID. So, you can either present two primary IDs, or you can have either one primary ID and one more is your secondary ID. So, what is a primary ID? So, your primary ID will be mostly a passport. The first one will be your passport, wherein it has your name, signature, as well as your recognized photograph. So all these three will be there in any government issued ID should contain these three. If that is there, then you can use that as a primary ID. If not, if you have only one ID where you have either your name or your photograph, name and photograph, or your name and signature, that's acceptable as a secondary ID. So you can either carry two primary IDs, or you can carry one primary ID and one secondary ID on the day of exam. Yes. So in order for you to pass, like Dr. Ankita briefed, you have to pass all four clusters. Each and every cluster is important. It's not just you will get an aggregate of all four to pass. No, it's not like that. You have to pass each and every cluster. Okay, so each of your clusters will be counted, and you will have to, there's a passing standard for each cluster that is determined based on the paper's easiness or difficulty levels and all that. So depending on that, you will have that percentage. And if you see, there are four different grades. So these are the four different grades. If you see, there is A, B, C, and D. So A and B are, if you have a perfect score, like that is 10% above the passing score, or 10% within the passing score, then you will be given grades A and B. So these grades A and B will indicate a pass in each of the clusters, and you have to make sure that you are getting either grades A or B in all of the four clusters. Okay, if you are getting a score of C or D in each any one cluster, is also considered as a close fail. Okay, so please make sure that each and every cluster you have a grade of A or B. So for you to study and prepare well for your ADC exam to be a wholesome preparation, you have to go through, apart from the subjects that you have learned in your dentistry, regular dentistry. Apart from that, you also have to go through few more training as in like the therapeutic guidelines that are issued by the Australian Dental Council. You have to mug them up. You have to know how they work there, what are the medications they issue for each and every particular disease. So you need to know that. So for that, you will be going through the trauma guidelines. And apart from that, you have your, sorry, TG, you have your therapeutic guidelines. And apart from that, you also have your trauma guidelines, infection control guidelines. And these two are also again very, very important. So infection control guidelines, unlike in India, there is specific rules of how you will sterilize. You have to know everything, because later on you will be the one who is in charge of, even though it's just a clinic wherein you're going to be employed, but still it will be your responsibility to carry out all the treatment in a proper way. Okay, so you have to know everything that is there in the infection control guidelines also. So this will be useful in both your part 1, part 2, and throughout your life in Australia. So you need to know the infection control guidelines. And apart from that, you will also be, most of the questions that they ask in ADC exam will be like cases, clinical cases. They will be giving you scenario based questions, wherein you will be given a scenario, and then you have to you have to answer the follow up questions. So for that, in order to be trained that way, to look out what are all the diagnostic points that are there, and how to diagnose, and how will you plan a treatment for all that, in order to be trained for those questions, you will be going through something called an ODEL book. So ODEL book is basically an book that is for ORE exams in the UK, but it is also very useful for you to practice for your ADC exams also. So we will be going through the ODEL book and the explanations, and how to approach a scenario based question and how to answer them. Apart from that, you will have all other important subjects presentations you will be going given. You will be taking classes, live lectures will be there for each and every subject. Once those are done, you will also have your mock exams on those particular subjects, as well as collective mock exams in the end. Like this. Yes. So for you to be prepared for the exam, so you will have to finish reading all the presentations. You have to go through the Odell cases, and you have to read TG. So TG is like the Bible of your Australian Dental Council exam. Okay. So you have to minimum at least 4 to 5 times you have to read through the TG in order to get a good score, because recently for the from the March 2024 exam, what they have done is like they have increased the number of questions that are there from TG. So if you are super thorough with TG, you will be in a very good position than your peers. Okay, so TG you will have to read at least 4 to 5 times, and apart from that you will have to go through your ICG and trauma guidelines also at least 3 to 4 times. And the very first thing is like for you to first remember things, like to understand. You first have to understand things, how it works, how it is in Australia, how it differs from your home country and Australia. You have to understand the basics there, and then you will have to like be ready. Only when you understand, you will be able to remember them and apply them in the exam. Whatever you are studying now is not just for your ADC part 1, it is also going to help you in your ADC part 2 preparation also, right? So you have to make sure that you understand every concept and then approach the question. There is there is no point if you are going to just read a whole lot of dentistry and go and appear for exam. Even if you're going to read only 90% of dentistry in that dental syllabus that is there, you should be understanding all the 90% and you should be able to deliver them properly during the exam. Nobody can read 100% of dentistry and go and give an exam. But whatever you read, you have to be very thorough, you have to understand it, you have to be clear with the concepts, and then you have to approach the question so that you don't make any mistakes in the exam. And also apart from that, you will also have to go through articles from the British Dental Journal and also from the Australian Dental Journals. And also there will be some DHSB guidelines that are there. You also have to go through all of them. Okay, so all these articles will be available in the LMS once the course starts. We will be teaching you everything like the presentations, Odell, ICG, TG, your trauma guidelines, everything will be taught. But you only have to sit and prepare the articles every week. You just have to pick 1 or 2 articles every week, go through the articles, mark the important points, and later when you read that particular subject or something, you can incorporate these points into your notes, and you can have a comprehensive reading for the subject once and go for exam. Okay, it might be overwhelming for you for the very first time, but then with the proper planning that we are going to give you, and also we will take you as much as we can, we will push you hard as much as we can. Just follow whatever the timetable is there. Please come to the classes regularly, attend the classes, go back, study them properly, attempt the mocks. As much as reading is important, that much of practice is also very important. You have to make sure that you practice a lot of MCQs in the preparation time. So now even if you're sitting for March, I think there is enough time, right? There is ample time for you to prepare for exam as well as to like practice too many mocks. So you have to practice more number of MCQs in order, like you might have understood the subject, you might have understood the concept, but it is very important for you to apply there. So you have to uh, you have to understand how the question is, what they would want, and then answer the question. So you have to focus more on practicing your MCQs. So you have to allocate time to study as well as to practice the MCQs. So you will have to just walk with us. We will take you safely. You just have to hold our hands, walk with us, and we will drop you there. The rest is in your hands on the day of exam. But until then, you have to have some discipline with the exam in order to clear the exam. So I wish you all a good luck on your journey. All the very best.
Thank you so much, Dr. Chandni. And everyone, please join the Discord platform as discussed with you to connect with your faculties for any sort of doubt and queries if you have. Also, we at Academically encourage you to please attend the live classes. But obviously, as you all are working professionals, we really understand your concern, and the recorded ones are always there with you. We will also be sharing the session timings and all the contents with you over our Discord platform. So please keep a check on that as well. Now, last but not the least, let's move on to the question round, everyone. If you have any question, you can please unmute yourself and ask. We are happy to answer that.
Okay. Am I eligible to attend the ADC one coming September?
I would request Dr. Ankita to please answer this question.
Dr. Catherine,
Yeah, ma'am.
you are asking regarding September 24 or September
Yeah,
25?
September 24. September 24.
24. Sorry, dear, you cannot sit for 24. The application period is already over, and those who have booked for September exam would be able to sit. You would
Okay, ma'am.
now be able to latest exam you would want to sit would be March 25.
Okay. Okay, ma'am. And how many attempts I can give for ADC 1 and ADC 2?
ADC 1 exam, you can give as many attempts till your initial assessment is there. And for ADC 2, after you have given your ADC 1, you have 3 years time period to complete. In 3 years, you would be able to give pragmatically 3 to 4 attempts.
Okay. Thank you, ma'am.
Okay.
Do we have anyone else for the question? Yeah.
Mine is actually, I want to ask 3 questions. The first one is from those of us that are planning to write the exams in March, what is the last day that we can send our credentials across to you for initial assessment? That's the first one. Then also for those of us that have practiced for some time now, I heard somewhere that the mean age for the mean age to practice the highest number, that once someone turns 45, that it will be very difficult for the person to get registered to get licensed in Australia. I'm actually 42 right now. So if I don't make it before that time, what is the essence of writing the exams? Because you said after my part 1, I have 3 years for the part 2. If something happened that I'm unable to get that part 2 by that time, I turn 45, is my effort not going to be wasted? That's all.
So your question is if you are not able to complete part 2 after giving part 1 in 3 years.
Yes, ma'am.
Is that right?
Yes,
No,
ma'am.
that it's a rule, and even if you exceed your validity expires after 1 day, you are not eligible. So suppose your part 1 results come on 1st November, your validity will be till 31st October. You would have to reset part 1. You would have to reset part 1 and then go ahead and complete journey of part 2.
My concern is the age.
Your concern is age. There is no age bar for clearing the ADC exam.
For getting licensed in Australia, I saw somewhere that it has to be 45, it has to be less than 45 years.
That would be for your migration. Okay. See, the migration is a separate other work which is going on. Okay. It can be migration of an engineer. It can be migration of a, other professionals. You could be teacher, you could be a pharmacist, you could be any professional who is trying to migrate to Australia, and the blanket rule is 45 years. And if you want to give, and if your profession is dentistry, for that registration, the body is ADC. For ADC exam, there is no rule of age. But mixing the 2 rules, it becomes a bottleneck that you cannot register after 45 years you can register. There can be other visa options for you if somebody wants to sponsor. But the practical, pragmatic answer, it would be very difficult. If a clinic really loves your skill, if you have something on your CV which is you are an implantologist in your home country, or you are a big time cosmetic dentist, and some clinic finds value in you, they would sponsor your visa. But as a giving you permanent residency, or that pathway would become a bit complicated. So
Right.
are you getting it? It is not the
Yeah,
rule by
it's okay.
dental bodies of Australia that you need to be under 45 years. That is by the government of Australia for the migration status.
Okay.
Okay. And for the dentists, there is no limitation of age per se.
Okay, then the first question I ask, for those of us planning to write in March, when is the last day that we can send our initial assessment documentation across to you?
Yes, the initial assessment generally takes around 8 to 10 weeks for it to be completed. So, any time before your application for your exam opens, somewhere around 2 months before prior to your exam. So, at least 8 weeks before that, you should have started your initial assessment. That is, by if you want to sit for March exam, at least by November or December, you should have started your initial assessment so that it is completed by the time your application window opens, and you will be able to only after your initial assessment is done through, you will be able to sit for your exam, like you will be able to apply for your exam. So where was I, like you didn't hear me completely?
No, you just stopped in the middle, doctor. It's okay. You
Okay,
can
fine.
go ahead. Yeah.
Yes, so somewhere at least around 3 months prior to the exam, you should have completed your initial assessment. Because
Yes.
2 months prior to your exam is when your window for application opens for the written exam. So by the time you should have your initial assessment done, so that will be a deadline.
Yes. Okay. So, doctor, did you get your answer?
Yes, I got it. So that means I should get everything ready by October, right?
Yes.
Yes.
All
So
right,
there
ma'am.
is no particular date given by ADC for initial assessment completion. Moment the next application period opens, you should have a valid initial assessment. It's all they want.
Any other question, please? So, this was all for our presentation. Thank you, everyone, and all the best for your new journey. And we are always there with you to hold your hands and take you through. This is me, Dr. Sonal, signing off with Dr. Ankita and Dr. Chandni. Thank you so much. And let's meet on Monday with our new session and our new class of endodontics. In the meantime, if you have any query, you can definitely contact me for that. Okay?
Thank you, everyone.
Thank you.
Thank you, everyone.